Thank you very much, and good morning. Thank you all. It's fantastic to see this great turnout, especially because it encompasses really so many of the countries that matter to this agenda and the leaders, technical leadership, political leadership behind an incredible mobilization. I would like to thank foremost the government of South Africa for the kind hosting and welcome to all of you and to myself here, and to see people really from all over the world coming together. I am honored to join these distinguished panelists and our partners from UNICEF, Save the Children, the MCHIP program, and so on. In particular, I'm very happy to join, just following the presentations from Agostino and Madame Michelle. In 2008, when I was with the Rockefeller Foundation, President Carter hosted a meeting of the elders with the Secretary General, who then committed to maternal child health as a priority for the UN and for his mandate. And it's been really fantastic to see the degree of attention and mobilization and results that we have really been part of in the last 5 years, thanks to that top-level political mobilization. So it's great to come with that commitment. And of course, Gracia Michelle, a leader of her own in this space. I'm very happy also and congratulate her on her being the chairwoman of the partnership on reproductive, maternal, and neonatal child health. We need that sort of jolt of energy and the convergence of many of the mobilizations that have been triggered last year around this particularly important area. We can count on her leadership for that. We have indeed much to be thankful for. It's an incredible, incredible moment for global health. We used to have 12 million kids dying every year in the 1970s. In the last 20 years, HIV incidence has been cut by half, maternal mortality by half. Over the last 20 years, more than 50 million children's lives have been spared. It's truly an incredible moment. And at the same time, that emboldens us to look at fantastic possibilities going forward. We can celebrate accomplishments, but we're only halfway there. President Obama, in the State of the Union this year, not only embraced the overarching goal of ending extreme poverty in our generation, but also ending preventable child and maternal death and the promise of an AIDS-free generation. And in the post-2015 discussions of the follow-up to the MDGs, likewise, there is indeed a warm embrace of ending preventable child and maternal death in a generation as something our civilization, our world can come behind, as we also ramp up our efforts on the last, now less than 1,000 days for MDGs 4 and 5. When we talk about ending preventable child and maternal death, we don't mean zero right away. We mean that the world can bring the levels of mortality to those enjoyed in rich countries, and that is indeed possible by reaching less than 20 per 1,000 child deaths and less than 50 per 100,000 maternal deaths by 2035. That will be indeed the case, and it is both bold but plausible. This goal of ending preventable child death was clearly accelerated with the call to action on child survival last year, co-sponsored not only by the US government, but also the governments of India and Ethiopia. And I'm glad to see Gita, who has been a partner all along with UNICEF in this mobilization, with a promise renewed, gathering so much energy, so many commitments. It's truly a second child survival revolution we are in the midst of, and the follow-up across the world, but particularly we have witnessed in Nigeria, in Ethiopia, in India, to Dubai with the Middle East mobilization, upcoming mobilizations in Panama City for Latin America. Everybody can see that for our civilization, for this generation, ending preventable child and maternal death is something that we should all go all the way for it. And we had just last week launched also a global action plan to end deaths from diarrhea and pneumonia. And now, of course, this very important, pivotal frontier issue, because we cannot end preventable child deaths if we cannot end newborn mortality. The child survival revolution of the 1980s is a shining example of how the world can come together and to address child mortality. We witnessed fantastic progress at the time. At the same time, neonates were not part of the equation at the time. We had so much to do, of course, but we are now really making up for that relative neglect. We have so much to do. newborn is indeed the final frontier, the Achilles heel that diminishes all of our shared success in child survival. And with 3 million kids dying in the first month of life, as we just heard, and over 40% of the child deaths, this is indeed the key area for us. And the Child Survival Call to Action last year has recognized this and added momentum to what many of you have been working already for years to bring focused attention and mobilization around this important issue. There have been powerful milestones already in this space in an effort to bend the curve on mortality to accelerate progress. One of those key milestones was the launch of the newborn Lancet series in the year 2005. The importance, again, of evidence of not only the degrees of the problem, but also the solutions has become paramount for our progress. We know it's preterm birth, it's asphyxia, it's sepsis, and that we have the solutions to prevent those deaths. The impact of such systematic reviews and evidence cannot be underestimated, and I encourage you all to continue to build the evidence. We have solutions, but if the problem is not solved, we have to continue to look at the evidence to do better and to find new technologies, new partnerships to help us get to where we need to go. This has certainly influenced us in the United States government and the Agency for International Development as we have been developing our own global assistance programs for newborn health. And I will recognize Lily, who has been really our champion here, working with many of you in this space. For centuries, the expectation that children will die was taken like a normal thing. In Europe, as well as many other countries, this has changed dramatically in the last century. And for newborn, less so, but in also much change. We cannot take for granted life. We cannot accept or expect a child to die. And one important way to prevent that, to help us shift the minds, to shift the normative framework, is to ensure we count kids. If our governments do not signal to a mother that the death of the child counts or the birth of the child counts, that signal translates in all sorts of things socially. So counting every birth and counting the outcome of every pregnancy and every birth is paramount. We now have cell phones close to everybody. We certainly have no excuse not to count. And I love the models, and of course our modeling of mortalities are very important, but we should be able to count every birth and every death and make sure that we begin to address each of those. Vital registration will also become more and more important, and as capacity grows in Africa and the rest of the world, we have again an opportunity to make sure that we have systems to make sure that we count every birth, we count every death. We are now empowered with strong evidence, with better capacity, with great leadership and more resources. We have now reached many other key milestones, but this is one that we will remember for years to come. And I believe we can make great progress together. We have all the tools to do so globally and locally, and our success starts here. This global action plan we are kickstarting today should gain momentum, not only in this year and through 2015, but all the way to end preventable newborn deaths in a generation. Thank you all.